There's been a lot of interest in recent weeks about vaccine breakthrough, COVID-19 vaccine breakthrough rates in different parts of the world. And some people have gone as far as to say that these vaccines are leaky and good for nothing. Others have been more realistic and, like we try to do on this channel, look at the data and see what answers we can get from that. I'm Dr. Gily, and on this channel I try to help you make sense of health information. And today we're going to focus for a couple of minutes on a report from the state of Oregon here in the United States. It turns out that the state of Oregon does a very good job at reporting COVID infection breakthrough rate and all these things in a very timely and accurate fashion. And I thought it would be interesting to take a look because they provide a window into these pieces of information that on a national level we don't have available, and I wish we would have those available, but like I said, they lag several weeks behind and oftentimes they are not complete. And I'm not quite sure why that is the case. It could be that the CDC is too slow to do it. It could also be that some states are not as good as reporting as Oregon is, and therefore the national data is difficult to put together. So let's have a look. This is the weekly report that the state of Oregon just published on October 21st here a few days ago, last week essentially. And what I thought was interesting, first of all, here is that if you look per week, each row on this table represents a week from September, the week of September 11 until this week of October 16. And it provides the actual cases or numbers of COVID infections that they have diagnosed in the state of Oregon during that week, as well as how many of those were breakthrough cases and what was the percentage of those breakthrough cases out of the total. And so you can see here from September until now, the percentage of breakthrough cases has hovered in the low 20s to sometimes high 20s, but the average is somewhere around 25%. So this, you have to take this with some caveats that they describe in the report. You can go and read about those. But the idea here is that out of all the breakthrough cases that have happened over the last month or so in the state of Oregon, 1 in 4 have been a breakthrough case from among people who were previously vaccinated. And this aligns pretty well with data from other parts of the world with some degree of variation. But this, and I think the other interesting thing to see over time would be, is this rate going up or not? Is this 28 an outlier? Or is it going to keep going up? I don't think, at least in Oregon and here in the United States, because this is about the time when the boosters were approved and started to be administered to people, and it could very well be that this drop from 28 to 23.5% of breakthrough cases could be attributable to those. A couple of other interesting things that I thought would be worth having a look together. For example, in this graph here, you have two lines. You have this orangey yellowish dotted line that represent how many cases of COVID-19, new cases, were being diagnosed per week per 100,000 population in Oregon. And you see here how at the beginning of the Delta spike, they have seen quite a bit of new cases. I mean, they went over 600 cases per 100,000 inhabitants here in late May toward September, late August, I should say, toward September. And since then, reassuringly, the number of cases have come down quite a bit. And while we have seen a little spike of new cases diagnosed among the vaccinated, they have barely gone above 150 per 100,000 inhabitants. So, same thing I said earlier, but in a graphical format. The breakthrough cases represent around 25% of the total cases overall during this Delta phase, which I think speaks favorably about the efficacy of vaccination, because again, here we are talking about new cases. We're not talking about severe cases or hospitalizations or death. We're talking about all the cases. So having only 25% of breakthrough cases overall, I think it's a positive finding. We can also dig or delve into how frequently they were seeing deaths and hospitalizations. See, these are cases, hospitalizations, and deaths here in again in Oregon during the Delta phase. In fact, this is cumulative cases. Anyways, and they broke them down by vaccine manufacturer. And in Oregon, like most of the U.S., they have the three: Pfizer, Moderna, and Janssen. So just looking at the number of cases per 100,000 people vaccinated, if you break those down, cases diagnosed or breakthrough cases, I should specify, the worst that we see is with Janssen, which is expected. It's a one-dose vaccine. Even the initial efficacy is lower than the others. And then you have Pfizer on the second place and Moderna providing the best vaccination. So if you want to do a, well, let's do it the other way. If we want to do a ranking, Moderna is the best in terms of preventing breakthrough cases, Pfizer is the second, and then you have Janssen. And the number of deaths you see here, you know, if you talk about 16,000 breakthrough cases in the case of Pfizer overall, you only have 600 hospitalizations. That's, I believe, around 2%. You can check me and do the percentage. But it's a really low number, and even lower number of deaths. Yes, these things happen, but they are, you know, you have 16,000 cases and you have 600 ending up in the hospital, and only, you know, about 1 in 4 of those ending up in death. And another graph here illustrating what I just said in a graphical format. You see here, these are cases diagnosed overall. These are the hospitalized and the death down here. So again, we see this disparity between seeing a fair number of cases being diagnosed. These are total cases, not per 100,000, the absolute number, total cases. Big, huge spike here with Delta. However, in terms of deaths and hospitalizations, it's fairly flat and reassuringly so. So the efficacy against severe disease is quite striking and encouraging. And then last but not least, very importantly, how often is to see these breakthrough cases of infection, of hospitalization and death among different age groups over there in Oregon. And what we see there is that in younger age groups, you know, if you go all the way up to even early 40s, you hardly see any deaths, you know, 0 or single digits, and you see very few even hospitalizations, although you do see a fair number of breakthrough cases. However, the higher you go on the age spectrum, if you get into the 70s and 80s, you see how the number of deaths start to become significant in double and triple digits over there, as well as the hospitalizations here. So again, this is not you know, earth-shattering news. We could have anticipated this, but we see that the most damage even breakthrough cases do among residents of Oregon is in the older age groups. And you know, they broke it down by race and ethnicity and things like that. So going back further in time, this is more like a monthly report. You know, this is going from March all the way to September of this year. And here you have the number of COVID-19 deaths and number of COVID-19 vaccine breakthrough deaths. So as the Delta spike hit, you know, you see here overall how it jumped between July and August from 81 to 418 deaths. When it comes to vaccine breakthrough deaths among those who had been vaccinated, it has gone up, but only from 16 to 96. So, and then from there to 126. And so And this is the percentages of those deaths. You know, we're staying in single-digit percentages before Delta. After Delta, we see, you know, percentages close to 20 or even over 20%. So, in any case, I thought this was an interesting data to present. I also wanted to include, but I didn't have time to locate the article. There is an article, maybe on a future video I'll present that, on a research in one of those macaque monkeys that were tested way back when the vaccines were being tested for efficacy and safety, before even the clinical studies in humans were done. And then those monkeys are still alive, in case somebody's wondering. They have done a study recently to try to expose one of those monkeys to the virus that is in circulation now. Again, that monkey was vaccinated way back over a year ago, they've been following to see what happens to them. And one of the things they did, one of those monkeys was exposed to the virus itself to see, is it going to get sick and how severe of a sickness they develop, and also importantly, what type of immune response they can see being elicited, if any, at this length of time in the monkey's body from the viral exposure. And the good news is the monkey didn't die, and there was a meaningful, though somewhat delayed, but meaningful and protective immune response that the exposure to the virus elicited from their memory cells, immune cells, in the monkey's body, which is, again, very reassuring. So that's the longest term indication of long-term protection from the vaccine in those experimental animals to date. And so I think we can, with some caveats, we can extrapolate the data from that to the human population and have some good degree of reassurance that the vaccine does continue to protect long-term, not just for the first 4 to 6 months, as some people have feared. So surely the immunity wanes and we see lower levels of antibodies and we can see breakthrough cases like we just discussed, but it's not like it goes to zero. In any case, I appreciate you being part of this, and look forward to your comments and reactions. Until next time, you guys stay healthy and stay wise.